The first presenter is going to be Max Kasy. He's a professor of economics at the University of Oxford. His research interests include publication bias, algorithmic decision-making, and he coordinates the machine learning and economics group at the Oxford University. And he's a senior research fellow at the Jain Family Institute. Max, the floor is yours.
Thank you so much. Thanks for having me and for organizing this conference. So I am going to talk today about pre-analysis plans, going back to the roots of bits. Can you all see the slides already? Okay. Yeah, so this is about a joint work in progress with Jan Spies, who is now at Stanford GSP. And so the title here is Rationalizing Pre-analysis Plans, Statistical Decisions Subject to Implementability. So it's going to be about when and why do we want to have pre-analysis plans and how can we justify them. And so by way of background, although I guess that's a bit unnecessary for this audience, trial registration and more specifically pre-analysis plans or specification of statistical analysis have become a standard requirement in many fields. Started in clinical research, is my understanding, in the 1990s, and then for experimental research in economics more recently, which is something I find kind of interesting as a history of science thing, also how like they're keeping these ideas imported from biostatistics and clinical research. So I guess some people here might have more insight into that. And so the typical justification that's given for pre-analysis plans, as far as I understand, is to kind of guarantee validity of inference or to correct for unacknowledged multiple hypothesis testing. But the idea is if you have selective reporting of results, p-hacking, specification searching, selective application of results, that's leading to distorted statistical inference. And so if researchers tie their own hands before seeing the data, that prevents selective reporting and thereby restores things like size control, unbiasedness, and so on. And so Andrew Gelman put this succinctly in a blog saying that pre-analysis plans are the frequentist inference, but RCTs are the causality. In some ways, they're like the conceptual baseline to even define these notions. And so I guess this push for pre-analysis plans has not gone uncontested. A number of people, including a number of editors in a recent editorial, have argued that it's maybe going too far, that pre-specification is costly, that interesting findings are often unexpected, flexibility is necessary, and so on. And so where we come in with this project is kind of trying to take a step back and think through why and when do we want pre-analysis plans and how can we think about the costs and benefits and the trade-offs involved. And so in a way, the most fundamental question for me here is why do we need a commitment device to begin with? So if you open like textbooks on theoretical statistics, you're not going to find any mention of pre-analysis plans. And that has a reason, and that reason is that the standard foundation for statistics and for machine learning for that matter is single agent decision theory. So the idea you have an agent with an objective function, an information set, an action space, and they're trying to minimize the loss or maximize the utility subject to these constraints. And so for a single rational agent, you have intertemporal consistency. Your future self wants the same thing as your past self. There's no sense in which you need to cheat yourself. And so from that standard foundation of statistics, there is no point to tie your hands to have a commitment device. And so I think that's also reflected in the fact that a lot of the discussions about pre-registration pre-analysis plans and so on are done more by empirical researchers than by statistical theorists and methodologists. So there's kind of this first question, when do we need such a commitment device? The second question is a bit more practical. Under what conditions are pre-analysis plans more or less useful? So how can we think about the benefits and costs and kind of the comparative statics that are involved here? And I will have some things to say about that today. And the third question is, how should the structure of pre-analysis plans look like? I think that's a super interesting question that I will not have as much to say about today, because I'm going to take a mechanism design lens in a minute, and in a way the space of possible mechanisms here is very large. And we're looking at a very specific class here, but I think there's a lot of work to be done thinking about other types of mechanisms. And so the perspective we're taking in this project is importing insights from contract theory and mechanism design into statistics, where we basically are going to argue that pre-analysis plans can be rationalized if we have multiple parties, if there are conflicts of interest, and there is some form of costly communication or asymmetric information. So under these restrictions, we do get dynamic inconsistencies potentially, and the role for commitment devices. And I would argue this is actually, in some sense, what is driving like a lot of the desire for pre-analysis plans. So a canonical example to keep in mind throughout my talk might be drug approval, where you have like a pharma company that's running clinical trials, and the regulatory authority like the FDA that's approving drugs, and they don't have the same objective because the pharma company cares more about profits and the FDA cares more about patient welfare maybe. And so with that type of conflict of interest, then it starts to make a lot of sense to think about commitment devices and constraints. And so what's nice about the mechanism design framework for us is that it allows us to actually stay pretty close to theoretical statistics, in the sense that we still can have the same objective functions and the same likelihoods, data structures. It's just that the social nature of inference comes in as a constraint. So not all decision functions are implementable. And so implementability, in the sense that mechanism design defines it, is a constraint on feasible decision functions. And with that implementability constraint, then PAPs might be part of the picture. And so the model that we're considering is there's a decision maker committing to a decision rule. So think the FDA or a journal editor, or maybe a reader of empirical research. Then you have an analyst, like a researcher or a drug company, committing to a pre-analysis plan before observing the data. Then they observe the data, report whatever they want to the decision maker, and then the decision maker applies their decision rule. And so here, I guess the decision maker commits, but it's, whether the analyst has a commitment device or not kind of arises endogenously in this model. It might or might not be optimal. And so what we're going to find in that type of framework is that pre-analysis plans are optimal if there are many analyst degrees of freedom and the source of asymmetric information is strong. So you need kind of the combination of these two factors to actually get a benefit from a commitment device. And so the model I'm going to present to you now, it actually took us a very long time to, in some sense, boil it down to the simplest possible case, where we kind of can make tractable statements that get to the core of the message we want to get across. So it's going to be necessarily pretty stylized. And at the end, if I have time, I'll talk a little bit about all kinds of model variations we have looked at. But here I'm trying to get across the simplest possible setting where this becomes interesting. And so the setting is that we think of the data of the analyst as a vector of binary variables. So you can think of this as a reduction where maybe each of these is the outcome of a separate hypothesis test. That might be the leading example. And we think of each of these having the same distribution, being Bernoulli with a mean theta. The theta is the underlying parameter, say the effectiveness of the drug. And the key statistical decision is selective reporting. I mean, it's generically true about statistics. You have a high-dimensional object, a data set, and you're boiling it down to a low-dimensional representation that you actually kind of put in a visible place in the paper. And so in this case, it's essentially selecting which of these hypotheses or which of these components to actually report to the decision maker. And then the decision maker makes a binary decision. So think approve a drug or not, publish a paper or not, reject a hypothesis or not, based on the data they got from the decision maker, from the analyst. And what makes this interesting now is that there's a conflict of interest. So here we're assuming there's a common prior, so that the conflict is not coming from different beliefs, although you could put it there too. Instead, what we're assuming that the analyst cares about two things. They just want a decision equal 1. So say they want to have the drug approved for profits, and there's a cost for them for reporting a lot. And so this is something where we looked a lot at different places of the model. We could put this cost. This is just the version that leads to the simplest analytical expressions. So I'm sticking to that in the talk, but you should think of this as just the source of the constraint, where without this cost, the optimum would automatically be just report all the data, and there's no interesting statistics, right? So, which is kind of the naive Bayesian recommendation. There's no point to have any researchers just dump all data sets in the public domain, and that's the end of the story. And so for that not to be optimal, you need some constraint. In this case, it's coming from this cost of reporting more components. And what the decision maker cares about here is they also like a decision equal 1, but only if the parameter theta is large. So say if the drug is actually effective, or say more effective than a benchmark theta lower bar. Or you could think of theta lower bar as being similar to like a significance level that you could pick if you think of this being expressed in the scale of p-values. And so the conflict of interest comes from the fact that, say, the lower bar is bigger than 0. So like if theta is small, the analyst wants a decision equal 1, but the decision maker wants a decision equal 0. And the timeline then is decision maker commits to decision rule. So here I say commit, although we could drop the commitment and the solutions essentially stay the same. Then the analyst reports a pre-analysis plan, which in this case is just a set of components of the vector x. So basically which hypothesis tests they're going to report. Then the analyst observes the data, chooses whatever they want to report, right? So they don't have to stick to the pre-analysis plan. They can report whatever they want. And then the decision rule is applied. And so a possible decision rule is to say, I'm going to ignore everything that was not part of the pre-analysis plan, but in principle, you could think of other decision rules. So again, like whether or not there is a commitment device de facto for the analyst arises endogenously in this model. And now we can talk about implementability in the mechanism design sense and relate this to standard statistics. So we can think here of reduced form mappings from the full data vector to the decision. And that's in some sense what standard statistics does, right? It's mapping data into decisions. So this would be like a testing rule, for instance, where in the model I wrote down the testing rule would be a standard cutoff rule. If you have a lot of successes, so a lot of ones in the vector, then you want to approve the drag or reject the hypothesis. Otherwise, you don't approve the drag or stick with the null hypothesis, right? So that's the optimal rule here because of a monotone likelihood ratio property, essentially. And however, not all of these rules are potentially implementable, and the implementable ones are exactly the ones that satisfy the following two conditions. First, there is like a reporting rule by the researcher, and then a decision rule based on the report that delivers this reduced form rule, and the reporting rule of the researcher or analyst is incentive compatible. So that's the key point here, right? So that's the incentive compatibility constraint that then reduces the set of implementable rules. And so that's what distinguishes this model from standard statistics where all rules are implementable. And two key implications of this is the researcher is always going to report the smallest possible set here that's going to lead to a decision of 1, right? Because everything beyond that is going to be wasteful from their perspective. No need to report more stuff. And they're never going to be willing to report more than 1 over C components here because C is the cost per component and 1 is the return of getting a decision A equal 1. So this is the key constraint here. They're not going to report everything. And so again, I won't have time to go into this in this talk, but an equivalent sort of constraint would be if there's uncertainty over the number of components the researcher sees, right? So even without communication cost, but with uncertainty over the number of components, you get very similar implications in comparative statics. And so the agenda then in terms of the analytics here is to find the implementable decision rules that maximize expected decision maker utility. So say patient welfare for the FDA, or it could be maximizing power subject to size constraints in a standard testing problem. Now, I won't have time to analyze this in detail, but I will talk in some detail about 2 examples. The first one here is the minimal interesting version of this model where we have 3 components in the vector X, right? So saying 3 hypothesis tests, so that gives 8 possible realizations for the vector X, right? 1, 1, 1 would be all successes, 0, 0, 0, all failures, and any combination of these. So each node here corresponds to 1 possible realization of the vector X. I arrange them so that more successes is higher up. And suppose that we're only getting at most 2 components to be reported by the researcher. That means we never know exactly on which node we are. We just observe 2 components at most, and that pins us down essentially an edge of this cube where this 3rd component is always left unspecified. And then what we're interested in is, are the reduced form mappings a bar here with publication rules or testing rules or drug approval rules that correspond to a set of nodes here for which we have a decision A equal 1. And so now let's think about 3 possible rules here. The one on the left might be, given what I put on the last slide, that's the first best but infeasible rule. So that's the rule that says we are going to approve the drug only if we have 3 successes, but not otherwise. Now, however, that's not possible to implement because we don't observe all 3 components. Now, what we could do instead would be to say, okay, tell me 2 successes, I don't care which ones, and then I'm going to approve. So that would give the symmetric cutoff rule on the right. And this might be optimal if the parameters of the model are such that actually 2 successes is large enough to give high posterior welfare for decision A equal 1. In that case, we might content ourselves with this rule. But it might also be the case that actually we don't want to accept for any of these nodes, but it might be a price we're potentially willing to pay in order to get the top node, right? So on average, at least, we are getting high welfare across these 2 nodes. And so then we might be in this middle scenario, and that's something a pre-analysis plan allows us to implement. If we say you report, if you constrain yourself to report the first 2 components, and we're saying we ignore everything else, but we need 2 successes in the first 2 components, then that puts us in this world. And so if we actually don't want these nodes in the second row, then that's giving us higher welfare than the publication rule on the right. And this one can be implementable, while this one is not implementable, even though this would be the first best. And so generalizing this insight somewhat, let's now look at general number of components, but restrict attention to symmetric rules for a moment. So rules without a pre-analysis plan, where we are just counting the number of successes and failures reported, essentially, right? So the decision only depends on the number of successes and the number of failures. And so here, first result would be this is exactly the set of implementable decision rules are the ones where the decision depends on whether your success is in a set script S, where script S is a union of intervals that have at length at least this. So that's a bit of a mouthful, but what this in particular implies is that if you have a decision rule that implies that accepts for all successes, then we have to go all the way down to n bar minus n bar PC, which is 1 over C here, and also accept for all these other realizations, because we can't really distinguish them from this top rule. And so that's best represented in a graph. So if you remember something of this talk, I think this slide would be the best pick. So let me talk you in some detail through what's going on here. So this is essentially a scenario from the last slide from the model with symmetric rule. And what I'm plotting here is the comparative statics with respect to the researcher degrees of freedom, or the number of hypotheses they can look at, or the number of components of the vector X. And so the horizontal dashed line here, that's the participation constraint. It's basically how many components we can at most get them to report. So that's the 1 over C in my model. And then there's a first best cutoff rule. That's this dashed line here. So that's what we would implement without a constraint, without the implementation constraint. Right. So this is if you want the appropriate multiple testing correction, we would apply in order to maintain size control while maximizing power. And then finally, the solid line here, that's the minimal cutoff we could apply, where we still just get positive welfare from the decision maker side. And so what's happening here, there's 3 possible scenarios. If the degrees of freedom are small, then this constraint is essentially not binding. We can just account directly for the multiple testing, correct for it, and implement the first best. And while we're in this range, more data actually end up being better, as we see in the right-hand figure. Same comparative statics, where the vertical axis is the decision maker welfare. But then we start to get to the point where the participation constraint really starts to bind, and p-hacking starts to matter in some sense. We're shaving down the effective cutoff, not accounting for the unacknowledged latent hypotheses that were tested. And that starts to distort things. We still get positive utility, even though we are over accepting the drug in some sense, but on net or on average, it's still positive utility. But then as the degrees of freedom increases, this problem becomes more and more salient. The distortions from this shaved down cutoff get bigger and bigger, up to the point where we hit 0 utility, and then everything breaks down. And there's no more utility at all. So basically, there's no publication or no drug acceptance. And it's kind of the worst case for both sides in this model. And so what you can see here is there's a sweet spot in the middle. And so that kind of reflects the trade-off between 2 forces here. On the one hand, more data is always better in standard decision theory. And that's what's called Blackwell dominance. As a decision maker, I always like to have more information rather than having less information. That's always going to increase my expected utility. However, then once we start kind of the p-hacking starts to get binding really and to distort things, then more data gets worse, or more degrees of freedom get worse, and that reduces utility. And so now we can see what a pre-analysis plan can do for us here, which is it can bring us to the sweet spot in the middle. It can in some sense artificially reduce the data that are available to the analyst. It's like throwing away data, but it's throwing away data exactly to the optimal amount potentially, where we are using as much data as we can for the decision without having too much of a distortion in terms of the resulting inference or decision procedure from the unacknowledged data or unacknowledged testing and so on. And so I guess I'm almost out of time here. So let me summarize and tell you a little bit about model variations we looked at. So starting point here is standard statistical theory and particularly single agent decision models cannot rationalize pre-analysis plans. They don't show up in any mathematical statistics or theoretical statistics textbook or any theoretical machine learning textbook for that matter. And again, the reason is if you have a rational single decision maker, they are going to be dynamically consistent, right? And so there's reasons that you can get inconsistency. There's one is like what psychology or psychology and economics have, I guess, focused on, which is bounded rationality of some form or other. Things like hyperbolic discounting, I guess, is a classic that would lead to inconsistent decision makers. That's not the route we're going here. The other route, and I think that's a key motivation for pre-analysis plans, is thinking about science and knowledge production as a social process involving multiple agents with different objectives, different information, and conflicts of interest. And so that too can lead to this dynamical inconsistency. And so what we then propose in this model, and I think that's an approach that can be more generally fruitful, is put on a mechanism design hat, which allows us to stay very close to classical statistics in some sense, because we're still minimizing a loss function or maximizing utility based on data. It's just that the social dimension of research imposes constraints on the statistical decision problem. And particularly in our model, these constraints are relevant when the researcher has many degrees of freedom. So there's a lot of different specifications they can try, a lot of different outcomes they can look at, and so on. And communication costs are high, at least in this baseline model, restricting how much is actually reported. Right. So one way to think about these communication costs might be attention costs of the reader also. Right. So typical abstract just says A has an effect on B or doesn't, which is kind of the minimal amount of information you can possibly communicate. Right. It's just one bit of information relative to data sets that might have millions of entries. And so, yeah, then a lot of time that was spent on looking at all kinds of variations of this baseline model. And one immediate one would be replacing the decision maker objective. Here's this utility with kind of this reference baseline point in the lower bar, is that we can think about size and power of a statistical test. What's nice about the mechanism design framework is the implementable rules stay exactly the same. This is just changing the objective on the decision maker side. So you can somehow separately treat the constraints and the objective function. We can look at not having just one theta, but multiple parameters. So hypotheses you could look at. You can think about analyst private information about signal validity. To think a researcher might know more about which are the valid identification strategies or which strategies would lead to smaller standard errors and so on. We can drop commitment, which is not really going to change things, except more things are possible subimperfect Bayesian equilibria here beyond just the commitment solutions that we discussed here. 5 is maybe, I think, the theoretically most interesting one here. If you have ex ante uncertainty about the available number of components to the researcher, and so the researcher knows how much stuff they could look at, but the decision maker doesn't, that actually has similar effects, as I mentioned in the beginning, as communication costs or inattention. So, which in a way might be also a very plausible assumption here, that we just don't know how much data the researcher looked at. And lastly, we can also move the communication cost from the decision maker to the analyst. So it doesn't really matter where in the model the cost shows up. Again, the same qualitative comparative statics go through. And again, like overall, we get pre-analysis plans do have a place in this type of model, but not always. It depends kind of on the model parameters. So for instance, if norms constrain the degrees of freedom already ex ante, because it's kind of, there's a standard thing to do in your line of research, then there's less of a value of these commitment devices. And the other thing I want to say to conclude is we look here at one specific mechanism or class of mechanisms, which is having this kind of cheap talk public commitment of what you're going to report. There are many possible other mechanisms you could look at, right? You could, for instance, look at adversarial refereeing, where you have, say, referees who demand robustness checks. So you could think of like randomly picking unreported components XI and demanding these are reported. You could think about sample splitting and safe houses for data, and many other possible institutional arrangements that go beyond what I talked here, which I think interesting things to consider within this general framework of just putting mechanism design type constraints on statistical inference and kind of expanding the theory of what statistics is about in this way. And I'll stop here and happy to discuss. And otherwise, thanks for your attention.